Are you a parent with concerns about your child's health? Many believe childhood diabetes is rare, but I'm here to reveal 7 critical, often missed signs that your children might have diabetes. We'll also touch on the surprising role of heritability, how much family history truly matters. This isn't about fear, but about empowering you with crucial knowledge. We're going to explore symptoms that often fly under the radar, explaining why early detection across the United States can change everything for your child's future. 1. Frequent urination, especially at night. One of the most common, yet often overlooked initial signs that your children might have diabetes is frequent urination, particularly noticeable at night. This symptom, medically known as polyuria, goes beyond normal bathroom trips. You might find your child needing to use the restroom far more often than usual during the day, or perhaps more telling, starting to wet the bed again after being potty trained for years. This isn't a behavioral issue, it's a direct physiological response to high blood sugar levels. When a child has diabetes, their body struggles to use glucose for energy. As a result, glucose builds up in the bloodstream. The kidneys, in an attempt to filter out this excess sugar, start drawing more water from the body's tissues to dilute the glucose and excrete it through urine. This increased fluid excretion leads to more frequent and often larger volumes of urination. Consider a healthy child's kidneys are highly efficient at reabsorbing glucose back into the bloodstream. In a child with diabetes, once blood glucose levels exceed a certain threshold, typically around 180 milligrams per deciliter, the kidneys become overwhelmed. They simply cannot reabsorb all the glucose, and it spills into the urine, pulling water along with it. For parents, this might manifest as needing to change diapers more often, or your older child suddenly needing to get up multiple times during the night to urinate. This symptom is often dismissed as a bladder infection or simply drinking too much liquid, delaying a critical diagnosis. However, if this change in urination habits is persistent and accompanied by other subtle shifts in your child's health, it warrants immediate medical attention. Early recognition can prevent more severe complications down the line. This next tip on food sequencing is what makes the biggest immediate difference. 2. Increased thirst. That's hard to quench. Closely tied to frequent urination is another key indicator. An unquenchable thirst, known medically as polydipsia. Your child might constantly ask for drinks, even right after finishing one. They might show an unusual preference for sugary beverages, which only exacerbates the problem. This excessive thirst is the body's desperate attempt to rehydrate after losing so much fluid through frequent urination. As the kidneys work overtime to flush out excess glucose, they pull water from the body's cells and tissues. This leads to dehydration, triggering the sensation of intense thirst. It's a vicious cycle. High blood sugar leads to increased urination, which leads to dehydration, which leads to increased thirst. The more the child drinks, the more they might urinate if the underlying high blood sugar isn't addressed. You might notice your child's lips are constantly dry, or they complain of a dry mouth. They might even appear unusually lethargic despite drinking large amounts of fluid. This isn't just about feeling a little parched. It's a profound, persistent thirst that ordinary hydration methods don't seem to satisfy. It's a significant departure from their usual drinking habits. For example, a child who previously drank a few glasses of water a day might suddenly be emptying pitchers or constantly refilling their water bottle. This symptom, when coupled with increased urination, paints a strong picture of diabetes. About 80% of children diagnosed with type 1 diabetes present with polyuria and polydipsia as primary symptoms. Recognizing this persistent and extreme thirst as a potential warning sign is critical for prompt evaluation. For many, this is a mistake. I'll explain the science right after this. 3. Unexplained weight loss. Despite increased appetite, this sign can be particularly confusing for parents. A child losing weight despite eating more than usual. This paradoxical weight loss, often accompanied by an increased appetite, or polyphagia, is a classic hallmark of undiagnosed diabetes especially type 1. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Without insulin, glucose cannot enter the body's cells to be used for energy. Even though there's plenty of glucose in the bloodstream, the cells are essentially starving. To compensate, the body starts breaking down its own muscle and fat for energy, leading to significant and often rapid weight loss. A child experiencing this might appear thinner, their clothes might become loose, or their face might look drawn. Yet paradoxically, they might be consuming larger quantities of food, constantly hungry because their cells aren't receiving the fuel they need. This isn't simply a growth spurt or changes in metabolism. It's a clear signal that something is fundamentally wrong with how their body is processing nutrients. This weight loss can be quite rapid, with a child losing 5 to 10 pounds or more in a matter of weeks. About 70% of children with newly diagnosed type 1 diabetes experience this unexplained weight loss. This combination of eating more but losing weight is a critical red flag that should prompt immediate medical evaluation, as it signifies severe metabolic disruption. Does this feel familiar? You've eaten healthy all day, but your evening blood sugar is still high. Let's break down why. 4. Extreme fatigue and lethargy. Children are naturally energetic, so a noticeable and persistent change in their energy levels, manifesting as extreme fatigue or lethargy, should raise concerns. This isn't just a child being tired after a busy day. It's a profound, debilitating tiredness that impacts their daily activities. They might appear unusually sluggish, struggle to concentrate in school, lose interest in playing, or fall asleep frequently during the day. This symptom arises because their cells are starved of glucose, their primary energy source. Even with ample food intake, without insulin to facilitate glucose entry into cells, the body lacks the fuel it needs to function properly. Beyond the lack of glucose, chronic dehydration from frequent urination also contributes to fatigue. When the body is dehydrated, blood volume decreases, making the heart work harder and leading to a general feeling of weakness. Additionally, the constant effort of the kidneys to filter out excess sugar puts a strain on the body, further draining energy reserves. Parents might observe their child becoming unusually irritable, withdrawn, or simply not themselves due to this pervasive fatigue. They might resist physical activity they once enjoyed or struggle to keep up with peers. Approximately 90% of children diagnosed with diabetes report significant fatigue. This persistent lack of energy is a serious sign that warrants medical investigation, as it indicates the body is struggling to meet its basic energy demands. Of course, everyone's journey with carb counting is different. I'd be very interested to hear what's worked for you. Share your single best tip in the comments below. It could really help someone else reading this. 5. Blurred vision. Blurred vision in children, especially if it develops suddenly, is a significant but often frightening symptom of uncontrolled diabetes. This is not simply needing glasses, it's a fluctuating visual disturbance that can make it difficult for your child to read, see the blackboard, or recognize faces clearly. High blood sugar levels directly affect the lenses of the eyes. When glucose levels are elevated, fluid can shift into and out of the eye's lens, causing it to swell. This swelling changes the shape of the lens, making it unable to focus light properly on the retina, resulting in blurred vision. This effect is usually temporary and reversible once blood sugar levels are brought back into a healthy range, but it serves as a powerful warning sign. If your child complains of difficulty seeing, squints frequently, holds books unusually close to their face, or expresses frustration with their vision, it should be taken seriously. This symptom might be more noticeable when glucose levels are particularly high or after they've had a sugary meal. In some cases, blurred vision can be the first symptom that prompts a visit to the doctor. While it can be alarming, it's crucial to understand that early intervention can prevent long-term vision problems. This isn't about permanent damage, but a clear signal that the body's internal environment is severely out of balance. Approximately 10% to 20% of children with new onset diabetes will present with visual disturbances. This early visual disturbance is a direct consequence of the body's osmotic balance being disrupted by high glucose. If you just had a light bulb moment from that tip, tapping the like button is a free way to support the channel. 6. Slow healing sores or frequent infections. Another less obvious but very important sign that your child might have diabetes is slow healing sores, cuts, or frequent infections, particularly skin or yeast infections. Healthy children tend to heal quickly from minor scrapes and cuts. In a child with undiagnosed diabetes, the healing process is significantly impaired. High blood sugar levels create an environment where bacteria and fungi thrive. Glucose acts as a fuel source for these pathogens, allowing infections to spread more easily and resist treatment. Furthermore, high glucose also damages the tiny blood vessels that supply oxygen and nutrients to tissues, which are essential for wound healing. It also impairs the function of immune cells, making the body less effective at fighting off invaders. You might notice that a simple scratch takes weeks to heal, or that a small cut becomes easily infected. Children with diabetes are also more prone to recurrent skin infections, such as boils, fungal infections between toes, or recurring diaper rashes that are unusually stubborn. Girls might experience frequent yeast infections, even at a young age. These infections might be resistant to standard over-the-counter treatments. About 15% of children diagnosed with diabetes will have skin infections as one of their initial symptoms. This impaired healing and increased susceptibility to infection are direct consequences of high blood sugar compromising the immune system and circulatory health. This is a critical sign indicating a weakened defense system that needs immediate medical attention. When I'm tracking my meals, this is the app I personally use because of its accurate food library. I'll leave a link to it in the description if you want to check it out for yourself. 7. Fruity breath, odor, or nausea and vomiting. These are more severe and urgent signs, indicating a potentially life-threatening condition called diabetic ketoacidosis, or DKA. DKA occurs when the body, lacking insulin, starts breaking down fat for energy at a rapid rate, producing acidic byproducts called ketones. These ketones build up in the bloodstream, making the blood dangerously acidic. One of the classic symptoms of DKA is a distinctive fruity or nail polish remover-like odor on the child's breath. This smell is due to the presence of acetone, a type of ketone, being exhaled. This is a very strong and unusual odor that parents typically notice immediately. Along with fruity breath, a child in DKA may experience severe nausea, abdominal pain, and vomiting. They might also have rapid deep breathing, known as Kussmaul respirations, as their body tries to expel carbon dioxide to reduce blood acidity. Lethargy and confusion can progress to unconsciousness if left untreated. DKA is a medical emergency and requires immediate hospitalization. Approximately 30% of children with type 1 diabetes are diagnosed with DKA as their first presentation, often because earlier, more subtle symptoms were missed. If your child exhibits any combination of these severe symptoms, especially the fruity breath, seek emergency medical care without delay. This is not a symptom to watch and wait on. It's a sign that their body is in a critical state and needs urgent intervention. 8. The role of heritability in childhood diabetes. While the signs and symptoms are crucial for immediate recognition, understanding the role of heritability can provide parents with valuable context and, for some, a reason for increased vigilance. Heritability refers to the likelihood that a trait or condition can be passed down through genes from parents to their children. When it comes to childhood diabetes, primarily type 1 diabetes, genetics play a significant, though not always straightforward role. Type 1. Diabetes is an autoimmune condition, meaning the body's immune system attacks its own pancreatic cells. While it's not directly inherited like a single gene disorder, there are specific gene variations that increase a child's susceptibility. The most prominent genes linked to type 1 diabetes are found within the HLA complex, or human leukocyte antigen complex. Certain combinations of these HLA genes can raise the risk of developing the condition by about 2 to 4 times compared to the general population. For instance, if one parent has type 1 diabetes, the risk of their child developing it is approximately 4% to 6%, which is higher than the general population's risk of about 0.4%. If both parents have type 1 diabetes, the risk can jump to between 10% and 25%. Siblings of a child with type 1 diabetes also have an increased risk, around 5% to 10%. It's important to understand that having these genetic predispositions does not guarantee a child will develop diabetes. It simply means they are at a higher risk. Environmental triggers, such as certain viral infections or dietary factors, are believed to interact with these genetic vulnerabilities to ultimately trigger the autoimmune response. Therefore, while you cannot change your child's genetic makeup, knowing if there's a family history of type 1 diabetes means you should be particularly attentive to the subtle symptoms we've discussed. Early detection remains paramount, as it can significantly improve long-term outcomes and prevent life-threatening complications like diabetic ketoacidosis. This awareness allows for proactive monitoring and prompt medical consultation should any warning signs appear. Understanding the glycemic index is key, but this next tip on food sequencing is what makes the biggest immediate difference. If you enjoyed this video, you will probably also like this one. Please subscribe to this channel and let us know in the comments your thoughts. Thanks for watching.